Your work does not go unnoticed, and we're all very thankful for you. So
thank you. That is so beautiful.
For today's episode, we actually brought in some medical professionals to react to a video that the entire FBE family, including our staff, reactors, and members of the Super Fam, all came together to make.
That's going to be really cool. I feel like everyone's been really rallying together for healthcare professionals recently. It's been really nice.
Thanks to all of our healthcare workers, along with all the bells and whistles.
That's awesome.
All the nurses and doctors out there making us all feel super safe here at home.
The hugest of thank yous to all of the healthcare workers and everyone out there risking your lives so you can save ours.
Thank you to all the doctors, nurses, and healthcare professionals who are keeping us safe and healthy.
To all the first responders, paramedics, healthcare workers,
firemen, policemen,
EMTs, healthcare organizers and coordinators.
I'm glad they're including everybody.
EMTs, healthcare organizers and coordinators.
Medical workers,
the goats.
and doctors.
EMTs, janitors.
The doctors, nurses,
janitors,
sanitation technicians.
I hope that you guys are staying safe and strong and healthy yourself.
That's so cute.
Trying to find a cure. We thank
Look
you
at the dog.
Stay safe.
We just really appreciate what you guys have been doing.
So many people have been doing chalk drawings and different things on the outside of the hospitals when healthcare workers leave for their shift. At the end of their shift, they've been seeing all these cool displays and thank yous, and that's really neat to see.
Thanking all of our first responders right now for putting their lives on the line and making us feel a lot more safe.
I'm from Indonesia.
I'm not gonna cry.
I'm from Indonesia. I want to say thank you so much for
really
all the
cool.
frontliners who
All the way
keep
from
fighting for us
Indonesia.
in this pandemic situation.
Oh, that's beautiful. Welcome.
While we're sheltering in place, we want to thank all the wonderfully dedicated doctors, nurses, and other healthcare workers.
You have put your lives on the line, and we truly thank you.
We'll keep doing our part. We'll keep doing our part, staying at home, but we really appreciate you and all the sacrifices you're making.
We've seen a lot of signs around the stations and the hospitals and things like that.
We appreciate all you do.
Oh, I'm gonna cry.
To all of the hardworking and brave people on the front line in the medical industry, the service industry, you are so loved and we can't thank you enough.
Dude, the fact that we have to make this video is insane.
Thank you so much for all the hard work that you're doing.
Oh my God, there's so many.
Your dedication and compassion mean the world to us.
Thank you to all the healthcare providers.
Thank you so much for all of your hard work.
Without you, the world would be a total mess.
We really appreciate all your hard work.
That is true.
It's really nice to hear. It's heartening. It helps, especially on those, 70, 80-hour work weeks.
We could not do it without you, and we are eternally grateful for the support you are giving to the country and the world in this time of need.
It's a great video. Thank you to all the healthcare workers for keeping us safe.
It's so cute.
That's so sweet. There's so many people.
Thank you to all the healthcare workers who are risking their health.
I want to thank all of our healthcare workers who help save people's lives during this difficult time.
My family has a lot of healthcare workers, so I feel y'all. Sending you thanks, gratitude, and a lot of good juju.
Love good juju, thank you.
I want to thank on behalf of all the seniors, all our doctors and nurses on the front line.
I have friends and family who are in the medical field and are dealing with this, and so I know it takes a truly special kind of person to put others' lives in front of their own. So thank you to everybody who's making that sacrifice.
When you don't realize the impact that it can take just helping one person.
Thank you for setting everything aside to take care of us.
You guys are the ones that are making us feel safe during this crisis.
May your midnight oil be caffeinated and your student loans forgiven.
God, that would be awesome.
Thank you all so much for all the long hours and hard work that you're putting in to stop this pandemic. You're going above and beyond, and we couldn't ask for
It's really cool.
Shoutouts to all the healthcare workers for basically fighting this battle for us. I'd probably be dead without you guys, so thank you.
That's my shirt.
I don't know about that, but
never give up.
We are all
Never
here for
give
you.
up. I love it.
Thank you, medical workers, for sacrificing your time and your energy to help keeping us safe.
These are crazy times right now, and we appreciate everything that you're doing to protect.
Very, very, very crazy times, for sure.
From me and my dog,
I love all the dogs.
Appreciate you guys.
Those are the things that mean the most.
I want to extend the biggest shout out and hugs to our healthcare workers. You guys are absolutely incredible.
Your work does not go unnoticed, and we're all very thankful for you. So thank you.
Thank you.
Thank goodness for what you do. I'm most grateful.
You guys
Thank
truly are
you.
amazing, and honestly, I can't say thank you enough for that.
Thank you, medical workers, for giving a true definition to the word hero.
You are our heroes. You are our heroes.
That's so touching to be called a hero.
We don't think of it as being like heroes or anything like that. It's just our daily job.
You guys are heroes.
You're heroes. You're truly amazing. Thank you for everything that you do.
You are in our prayers.
We love you so much. Celebratory bubbles. Woo! Stay safe out there.
Everyone loves bubbles.
Thank you. That was so sweet.
It is really nice to see that all of these different people just, that they're very appreciative. And it's nice to see that most of them are in their houses. So it's nice to know that people are staying home.
That is so beautiful. We are sacrificing our health, but we're fighting for everyone else's. So knowing that people realize why we're doing what we're doing, it's just emotional to think that they literally took time out of their day just to let all of us know.
So first off, just wanted to say thank you so much for taking the time out of your busy schedule to be with us here today. And again, for everything that you've been doing to help your community.
It's my pleasure.
No problem, man. The honor's mine.
For this video, we're actually going to be encouraging our audience to donate to Google's COVID-19 Solidarity Response Fund. And they're going to match every $2 to $1 donated. So links to that are going to be in the description.
Fantastic. That's great to hear.
Can you tell us a little bit more about what you do for work?
I am an emergency room nurse. So I am either the first person you meet when you come in the door in triage, or I'm a nurse in the back where taking care of patients when they come in through the front door or they come right off the ambulance.
I'm an ER physician. New York City got hit really hard, and it's been a struggle to be at work.
I'm a EMS captain in a major metropolitan fire department in Baltimore, Washington area. I'm responsible for all the EMS that goes on in the jurisdiction I work in on a daily basis.
I'm an EMT, which is an emergency medical technician. I'm in charge of taking patients that are in critical care in the ICU, that are on respiratory distress, stuff like that, from hospital to hospital or hospital to nursing home. So we are in charge of taking care of the sickest of the sickest.
With kind of everything going on right now, it's safe to assume that your typical workday has become a lot more stressful, tedious, and especially as many of you guys are potentially putting yourselves in harm's way to do what you do. For you, what keeps you going to continue to work during this time?
Number one, it's my job. It's what I'm supposed to do. It's I think for most of us in the healthcare field, it's our passion. It's what we do. It's what we're trained to do.
You get into this work, into healthcare. You don't do it unless you're very passionate about it. You love what you do. You love taking care of people. And regardless of the circumstances and everything that's changed with this pandemic, that doesn't change. And then the support from the community has been amazing. And honestly, that definitely helps, just seeing how much people appreciate what you do.
In the beginning of our careers, we decided that we wanted to take an oath to do things that other people wouldn't want to do. Our people are a little scared to do it, and that's totally okay. It's okay to be scared. We wanted to make sure that other people, and not just them, but their kids and their grandkids, can grow up living in a happy and healthy world.
Due to COVID-19, the typical day has changed dramatically, affecting many people's jobs, with many currently working from home like us. But as a medical worker, you're someone whose job has been tremendously affected and generally are not working from home, but rather on the front line. So what has that been like?
Well, personally, my hours have been cut down a lot. We want to decrease the amount of people and decrease the amount of just interaction, like non-necessary interaction. So we only have one person going into the department every day, which is a challenge.
In the beginning, our dispatchers were doing a good job of screening the calls, asking the travel questions and the fever questions. Well, now as we know that any kind of symptom could be the COVID-19, we're treating everybody like they have it. So on every call, we have to put on a mask, gown, gloves, eye protection, and all that stuff.
We are in full protective gear the entire time. So what that means is it's very difficult to take any breaks. It's a whole process to put your gear on and take your gear off. So now it's more like trying to strategically plan when you can take a lunch break and a bathroom break at the same time, so that you only have to take your stuff off and on, as little as possible.
They've limited visitation in terms of parents and family members that are allowed to be at the bedside all at once. It's one parent per patient at once, which I know has been very, very difficult for a lot of families, especially with babies and children who are critically ill. Parents not being able to be there to support their children is really stressful to watch, also to enforce.
So Allison, you're actually the first person that I've talked to who's gotten sick during this whole thing. So for you, what was that like, and what kind of changes did you have to make?
I was actually in our COVID unit the week that I got sick. Friday night, probably around midnight, I started to get a little bit of a scratchy throat, barely a dry cough. I woke up and I absolutely felt like I got hit by a truck. So I was talking to one of my coworkers and I was like, I don't know, it feels like the flu. She finally convinced me to go get tested and it came back positive. I had been sleeping in the same bed as my significant other. So it's like, oh my gosh, I really hope he doesn't get sick. Even with the quarantine and, social distancing, not supposed to be going anywhere, you can still go to the grocery store. You can go for a walk with your dog. I was not supposed to leave the house at all. So it's been about 3 weeks of just having to stay in 1,000 square feet, not being able to do anything. So it's definitely been stressful.
So finally, as somebody who is currently working to help stop this virus, what can everyone else do that can help?
Stay home. Stay home. Just stay home. I have the next 7 days off. I'm not going anywhere. I live in a 400 square foot box. I don't like this very much, but I'm doing it because it's necessary.
A lot of states want to open up and things like that, and we're currently on the East Coast, and the numbers are not going down where I'm at. They're going up, and people are protesting and want to go back. I get they want to go back to work, but the best thing to do is stay home and just do the social distancing thing.
COVID-19 is a aerosolized droplet spread virus, and we know from many studies from influenza and other respiratory viruses that wearing a mask, just even a simple mask, not even an N95 mask, can definitely cut down transmission. If we would have all started wearing masks 2 months ago, things would have been vastly different.
I know it seems like we're things are getting a little bit better right now. There's less patients that are coming into the hospital, but it's still really early on in the game. And it's important for people to keep doing the stuff that they have been doing to help prevent the spread. We have limited space in hospitals, limited ability to help people and treat people. So the more people work together with us, the better things will be for everyone.
Hey everybody, Lauren, producer here at FBE. Thank you guys so much for watching this episode, and thank you to all the medical workers who shot with us today and all those out there who are helping their communities. If you guys want to go donate, make sure you click the links down in the description where you can donate to Google's COVID Solidarity Response Fund. Go check it out. Bye everyone, and stay safe.